It's pretty terrible, to be totally honest. It's like the entire world flipped upside down. So before we would see, one isolation patient maybe every couple days in the ER. Now we're seeing every single isolation patient every day in the ER. So wearing personal protective equipment is very strange. The way that I have to leave the house and come back to the house has changed completely. I now go, when I'm getting back to the house, I basically strip down, throw my stuff straight into a hot washing machine, and then I go take a hot shower before I go anywhere near any of my family members. So we decided to self-quarantine as an entire family. So my wife and I are both medical. And we just assumed that our family was going to get it, but also to try to keep anyone else from getting it. But most days I leave the house by 7, then I'm home 6 to 6:30 at night, have dinner and try to put the kids to bed. Pretty much every day is a 12 to 14 hour day. And it depends on what I'm doing at the time. We've actually set up a lot of telemedicine. So I'm doing emergency medicine through telemedicine, which is a very strange new phenomenon. Even so much that if a patient comes to the emergency department, I will actually see them before ever seeing them in person, because I can see them without exposing myself to them or them to me. And patients have surprisingly really enjoyed that. One, as you can imagine, if you're seeing, here, do a little example, a patient like this, it's much harder to get any sort of patient interaction, and you would have, the patient has a mask on, you have a mask on. So being able to see their face is actually a really important part of the doctor-patient relationship. So having technology to do that has been really helpful. It's a little bit weird, but it's been very helpful. It's also helped us decrease the PPE we have to use. We're using a month's worth of PPE in one day right now. So before we would use 2,500 masks in a month, now we're using 2,500 masks in a day as a hospital system. The UMC nurses, techs, all of the patient care people, that even housekeeping, is in the same boat now, which is kind of nice that everybody's all of a sudden on the same very strange team. But they've done a lot of things to work together to get PPE groups that they're sharing stuff with each other. They're buying their own supplies as they need. That's what America needs to do to support their healthcare system, is get all of those supply lines working, get all of this testing that keeps being talked about actually functioning.